So in today's class, we'll try to discuss about skeletal system. See, in osseous system, the study of bones, joints, muscles, tendons, everything is very important. Okay. So in skeletal system, we all know that skeletal system and bones are very important for movement of the body. They are very important in movement. In previous class, we tried to understand the importance of bones or the functions of bones. In that, functions of bones, skeletal system is very important in movement. It helps in locomotion. Along with that, skeletal system is important in protection of certain organs. Okay, skeletal system is important in protection of certain very vital organs. For example, you see we have heart and lungs are protected in the ribs, and we have brain is protected in the skull, in the bones of the skull. Okay, we will try to learn all those bones now. So the first important function of skeletal system is it is important in movement, locomotion. It is important in protection of certain organs. And in previous class, we also have studied bones are important in they will store minerals. Particularly, they will store calcium, and they are important in storing phosphates also. Okay, so calcium is very important. In previous class, we tried to understand the functions of calcium. All those basic things, it is not mandatory for us right now. फिर lecture बहुत बड़ा हो जाएगा. Okay, so we will try to go very fast. One thing is bones are very important in locomotion. Bones are important in protection of certain organs. They are important in storing some minerals. Along with that, they will give shape of the body. What they do, they will give shape of the body. And sometimes what bones does, bones will produce, because bones contains bone marrow, right? Bone marrow contains stem cells. This bone marrow is helpful in production of certain blood cells. Especially it is important in hematopoiesis. Hematopoiesis means it is important in production of some red blood cells, which is also called erythrocytes. Erythrocytes are red blood cells, RBCs. Okay, see, just now I told skeletal system means bones. Skeletal system is very important in movement of the body. See, to perform physical activities, to play, to dance, to run, to do activities, for all that, skeletal system is very important. In this movement of the body, not only skeletal system is important. Along with bones, we require muscles, we require joints, and we also need obviously bones. So these three things together, muscles, joint and bones, these three things together, they will help for the movement of the body. Okay, and these three in combination is called musculoskeletal system. The science which helps us to understand about muscles, joints and bones. Together, these three components is important in helping movement, and these three components is called musculoskeletal system. And one thing in previous class I tried to tell you, the study of these muscles, joint and bones, or the study of musculoskeletal system is called orthopedics. So we have orthopedic department. Okay, orthopedics is the medical science which helps to understand the diseases of joints, the diseases of bones, their prevention, their management, their treatment, their surgeries, everything which is dealing about muscles, joints and bones is called orthopedics. Okay, so in hospitals from second year, when you go to hospital, you will be posted in orthopedic department. Orthopedic cases will be coming. Orthopedic cases matlab yaad rakh lena, patients who are having disorders either in muscles, joints and bones. Okay, so these are some basic things we understood. What is musculoskeletal system, what is orthopedic department. Clear? Ab dekho. In especially in skeletal system, we are not understanding about muscles, and we are not learning about tendons and joints now. Joints and about tendons we'll discuss in next classes. In today's class, we'll try to learn only skeletal system. Mainly, the skeletal system is divided into two main parts. One is axial skeleton, axial skeleton, and second one is appendicular skeleton. Appendicular skeleton. I'll try to show you all the images. You have to see, please just थोड़ा पेशेंस रख के पूरा देखते रहना, सब सिखाता हूँ. ओके, we are trying to learn about skeletal system. In skeletal system we have two types mainly, axial skeleton and appendicular skeleton. And together this axial skeleton and appendicular skeleton, we have total 206 bones. Yes, we have total 206 bones. Can anyone tell me what is the difference between these 206 bones? Are mainly in the adults. In adults, for example, the bone count in our body are 206 bones. Can anyone tell me bone number is same as in children and
No,
in
sir.
adults? What is the difference between the bone count in children and in adults? Can anyone tell me? Children, in neonates means newly born people, newly born child is called a neonate. Up to 1 month if they are called neonates. Neonate ke baad fir we call them children. Okay, in neonates and in children the bone count is slightly higher than 206 bones. Why? Because there are certain bones which are not fused. They are not fused, but in adults few bones are fused and they are counted as single bone. That's why in children and in neonates the bone count is higher than adults, and the flexibility of children's and in child and in neonates is very high, because they have more joints and they have more bones. Okay, joint agar zyada hai, bones zyada hai, to kya hoga? Flexibility is very high. And in adults body don't have flexibility because most of the bones will fuse together and they'll form single bone. Okay, which bones are fused, that all I'll discuss now. Okay, so in adults we have 206 bones. Axial skeletal, see, in axial skeletal we have total 80 bones. We have 80 bones in axial skeleton. I'll try to tell you those 80 bones. Axial skeleton. Now, what is the composition of axial skeleton? Who will tell? The composition of axial skeleton is we have skull. Okay, in skull we have cranial bones. In cranium we have 8 bones. Okay, and we have facial bones. Face के अंदर we have in facial we have total 14 bones. So 8 plus 14 or 20. In skull we have total 20 bones. In head we have 20 bones. Okay, so this is one composition of axial skeleton. And number 2 we have hyoid bone. This is a significant bone, actually very special bone which is present in the neck. Actually in previous class I was explaining about the thyroid gland, right? Near the thyroid gland we have one very special bone which is called hyoid bone. Okay, hyoid bone is one, this is special bone. Okay, and 3, next we have auditory apparatus. We call it auditory apparatus or ossicles. We call it ossicles. See, here we have 6 bones. Here particularly what we have in the middle ear, actually ear ke andar, inside the ear we have very small bones which are important in maintaining the vibration, and because of their vibration we feel or we get auditory signals. So in that we have malleus, stapes, stapes, and incus. And along with these, actually these are 3 very small bones. In auditory ossicles we have 6 bones. Along with these 3 small bones we have some accessory bones also. So total in auditory ossicles we have 6 bones. And number 4 we have vertebral column. In vertebral column we have 26 bones. And finally the 5th one we have thorax. Okay, in thorax we have 25 bones. So you can just count all these bones. Total number of bones in axial skeleton is how many? We have 80 bones. So axial skeleton is composed of skull. In skull we have cranial bones and facial bones. And in axial skeleton we have hyoid bone, auditory ossicles, vertebral column and thorax. ये सब याद रख लेना. See, anatomy, physiology, morphology, all, if you want to study, if you want to learn, you should remember all these names. ये names बहुत important है. And if you remember all these things, it will be easy for you in upcoming lectures. एक ही बार में ये सब नहीं आएगा. So I keep on revising, repeated में बोलते रहता हूँ, याद रख लेना. Just previously what I told, in skeletal system what we have? In skeletal system we have axial skeleton, okay, and appendicular skeleton. In axial skeleton, how many bones we have? We have 80 bones. And in appendicular skeleton, how many bones we have? 126 bones. And total we have 206 bones. So in axial skeleton, we have skull, hyoid bone, auditory ossicles, we have vertebra, we have thorax, okay. All these things we will try to discuss now with the images, okay. This is about axial skeleton, and about appendicular skeleton also we'll try to discuss. Yeah. So see, अभी थोड़ा images डाल के आपको समझाने की कोशिश करता हूँ. Okay, see, in axial skeleton what we have?
Skull.
We have skull, we have rib cage, I mean vertebral column, and rib cage and vertebral column. Okay, so total how many bones we have in axial skeleton? We have 80 bones. ये चीज याद रख लेना. Now you see, in previous class, yes, I was explaining you, ये hormones के बारे में already इससे पहले बताना था आपको. See, to develop bones, bone develop होने के लिए we need certain hormones. This is very, very important, because when patient comes to the orthopedic department, always we will try to check the patient's serum hormones. अगर serum hormone level कम हो गया ना, तो definitely they will cause bone disorders. So in hormones, the first hormone is growth hormone. Very, very important. Growth hormone is released from anterior pituitary. In previous class I told, growth hormone is very, very important. It is helpful for bone development, bone growth and muscle growth. Actually, this growth hormone acts on each and every cell of our body. Each cell of our body. It is very, very important. Growth hormone is very, very important. Growth hormone क्या करेगा? Growth hormone is important in development of bone. It is important in development of muscles. See, if growth hormone is adequate, patient's size, shape will be inadequate. If growth hormone secretion is high, what happens? The size of the organism or the size of the body becomes very tall. थोड़े लोग tall हो जाते हैं. Gigantism बोलते हैं उसको. Why? Their hand size, bone size, their height is also very high. Why? Because their growth hormone release is very, very high. Growth hormone अगर किसी के body में ज़्यादा हो गया, तो what will happen? Bone size will increase, muscle size will increase. Okay, but that is not normal condition. Future में फिर वो hypertension crisis में जा सकता है. Many other disadvantages are there with this high amount of growth hormone. Growth hormone कभी भी ज़्यादा नहीं होना चाहिए. It should be in normal range only. Anyways, so growth hormone is one hormone which is important in development of bones. And next one is thyroxine. Thyroxine is released from thyroid gland. This is also very important. This is also directly and indirectly it is helpful for development of bones and muscles. Okay, and we have androgens, very, very important. Testosterone. Testosterone is considered as male androgen or male sex hormone. Testosterone फीमेल में होता है कि नहीं? कौन बोलेगा? टेस्टोस्टेरोन फीमेल में होता है कि नहीं? Who will tell? Fast. Testosterone is available in female or not? अगर फीमेल में है तो उसका एक्शन क्या होगा? Testosterone is present in females also. Females में भी testosterone होता है, but its concentration is very, very less. So here the testosterone concentration is dominated by estrogens and progesterones. Estrogen and progesterone are female sex hormones, whereas testosterone is male sex hormone. These estrogen and progesterone in females, they will what they will do? They will decrease the concentration of testosterone. But females में testosterone होता है, and this testosterone in females, it is important in bone development and muscle development. Muscle and bone development. Females में भी muscle चाहिए, females में भी bone चाहिए. Okay, and one important thing you have to remember, as the testosterone concentration is quite higher in males, that's why male muscular mass, male bone mass is higher when compared with female muscle mass. Okay, why? Because testosterone is higher in males, and along with that, testosterone is directly it is acting on bone marrow. It is acting on bone marrow and it is helpful in production of RBC and hemoglobin. In previous class I told, see, hemoglobin of male concentration, hemoglobin normal range in males is 14 to 16 and hemoglobin in females is between 12 to 14. Why hemoglobin is less in females and why hemoglobin is high in males is because of this testosterone only. Testosterone is dominated in males and estrogen is dominated in females. That's why muscle mass हो गया, bone mass हो गया, bone strength हो गया, and hemoglobin concentration हो गया. Everything is slightly higher in males than females. That is because of testosterone. So in development of bones, growth hormone is important, thyroxine is important, testosterone is important, and estrogen in females is important. Along with this, there is one very very important hormone called calcitonin. Calcitonin and PTH, parathyroid hormone we call it. These both, calcitonin and parathyroid hormone, are mainly interlinked with calcium homeostasis. That's why they are directly linked with bones. About this calcitonin and parathyroid hormone, I'll discuss in some other slides. Okay, I think everybody are following me. याद रख लेना, growth hormone, thyroxine, testosterone, estrogen, not progesterone. Okay, not progesterone. Estrogen in female is important in bone development. Testosterone in male is very important in bone development. Females maybe testosterone is important in bone development. Thyroxine, growth hormone, calcitonin and PTH, parathyroid hormone. These all hormones are important in maintaining bone homeostasis. कोई कोई हार्मोन बोन डैमेज करता है, कोई हार्मोन बोन फॉर्मेशन को हेल्प करता है. ओके, these are very important hormones. Okay, so growth hormone 1 is important, thyroid hormone is important, thyroxine, we have testosterone and estrogens, calcitonin and parathyroid hormone. These are important. About this in endocrinology we'll try to discuss in detail. Okay, so growth hormone is का direct relation. They are helpful in muscle development, bone development, and they are also important in maintaining the fat metabolism. Okay, here ghrelin is very important. This we'll discuss one day. ये सब अपने को अभी जरूरत नहीं है. ठीक है. So functions of bones already I told. It is important in a framework of the body. It is important in attachment of muscles and tendons. Because of that only it is helpful in movement. Okay, so for movement purpose everything, joints and bones are important. Bones will protect the organs. Okay, bones will have certain cavities. For example, they will form cavity, and in this cavity they will protect certain organs. And it is important in hematopoiesis for formation of RBCs. Also, bones is important. And along with this, it is storing some minerals, especially calcium and phosphate. All these things you have to remember. Okay, functions of bones के बारे में if anybody asks you, definitely for 4 marks or for 2 marks it will come. Write functions of bones, you should write. Okay, so we discussed about skeletal system classification. We have axial skeleton and appendicular skeleton. So we'll try to discuss about axial skeleton in detail. Axial skeleton in detail. देखो, just now I told axial skeleton is the main constituent of skull, vertebral column, ribs and sternum, right? And in this we have total 80 bones. Okay, that we will try to discuss now. And in appendicular skeleton means other than axial skeleton, यहाँ पे skull, vertebrae, ribs and all जो छोड़ के बाकी के पूरे, we have shoulder girdle and upper limbs, we have pelvic girdle and lower limbs. Okay, image है यहाँ पे कहीं, हाँ, yes, see the upper girdle and upper limb, the lower girdle and lower limb, these are appendicular skeleton. And in axial skeleton what we have? In axial skeleton we have skull, facial bones, vertebrae, vertebral column, and we have rib cage. Okay, this blue color part is axial skeleton and this red color bones are appendicular skeleton. Just now I told in axial skeleton total we have 80 bones. In that cranial we have 8 bones. We'll try to discuss about each and every bone of cranium. We have facial 14 bones and we have hyoid bone. ये देखो, ये this is hyoid bone. Hyoid bone is present in the near the thyroid gland. यहाँ पे कहीं है, yeah, this is hyoid bone. Okay, यहाँ पे इसको बोलते हैं hyoid bone. I think my screen is visible to you all, right? Screen दिख रहा है इसको, hyoid bone. It is very special bone. इसके बारे में भी I will try to tell you. Okay, so hyoid bone एक है, and we have auditory ossicles or auditory apparatus. In that we have 6 bones. In here in these 6 bones we have very very small bones. Small bones के नाम क्या बोला था? malleus, we have stapes, and we have incus. These three bones are very important in sensing the auditory signals. Okay, अपने कान में जो sound आता है ना, that sound is mainly caused due to the vibration of these bones only. These bones will vibrate and they'll send information to brain, and with that we will sense the sound of certain vibrations. Okay, and among these three bones, stapes is the smallest bone. Actually, these three bones are smallest bones of our body. In this, stapes is the smallest bone. ये कभी कभी कोई पूछ लेता है smallest bone क्या है, कहाँ रहता है, उसका function क्या है. All these things you have to remember. Okay, and vertebral column, we'll try to discuss about vertebral column in detail. And thorax में sternum, ribs ये सब होते हैं. Okay, अभी क्लास शुरू नहीं हुआ है. These are all basic things only. Now we will try to begin. In IC, we discussed about axial skeleton, or in appendicular skeleton. In appendicular skeleton, what I told: upper girdle and upper limbs, lower girdle and lower limbs. Simple. So in upper girdles, what we have? We have clavicle. We have two clavicles and two scapula. Okay. And in upper limbs, see, upper limb we have humerus, the longest bone of our hand. Hand के अंदर longest bone क्या है? We have humerus. On two hands we have humerus. We have radius and ulna. Radius, ulna. We have carpels, metacarpals and phalanges. Carpels कितने हैं? 16. याद रख लेना. 16 carpels, 10 metacarpals and 28 phalanges. ये numbers also very important. So upper side what we have? Upper side we have upper girdle. In that we have clavicle and scapula. This is scapula. And this is collarbone, which is clavicle. Okay, so two clavicles and two scapula. And on the upper limb we have humerus, radius ulna, यहाँ पे radius ulna, carpels, metacarpals and phalanges. Okay, and lower side we have pelvic girdle, which is called lower girdle. In that we have hip bone, pelvic bone and coccygeal bone. And नीचे पैर के अंदर क्या है? How many bones we have? Femur. We have two femur. This is longest bone of our lower limb, femur. And here we have patella. इसको patella बोलते हैं. It will be moving. Okay, patella. We have tibia and fibula. Tibia and fibula. We have tarsals, metatarsals and phalanges. The appendicular bones. In appendicular bones, how many bones we have? Total we have 126 appendicular bones. We have two clavicle, two scapula, humerus, ulna, humerus, radius, ulna, carpels, metacarpals, phalanges. Femur, patella, tibia, fibula, tarsals, metatarsals, phalanges. Okay, क्लियर. एक चीज याद रख लेना. सी, हैंड के अंदर इन अवर पाम, इन पाम वी हैव कार्पेल्स. इन पाम वी हैव 16 कार्पेल्स, बट इन द पाम ऑफ आवर लेग वी हैव 14 टार्सल्स. 14 टार्सल्स होते हैं यहाँ पे. हैंड के अंदर वी हैव मोर बोन्स देन इन लेग. ओके, फीट के अंदर कम होते हैं टार्सल्स. वी हैव 14 टार्सल्स, 10 मेटाटार्सल्स एंड 28 phalanges. Same, metacarpals, 10 metacarpals and 28 phalanges. Phalanges are the bones of fingers. Okay, anyways, so इसके बारे में और डिटेल में one by one we will discuss. Now we will go with the bones in cranium. Cranium के अंदर कितने bones थे? We have 8 cranial bones. Yes, in 8 cranial bones, see we have frontal. This is frontal bone. Frontal में एक ही bone होता है. Now see in skull, skull के अंदर कितने bones बोला था? 20 bones. In skull we have 20 bones. Yes or no? In skull we have 20 bones. Skull के अंदर we have 8 cranial bones and we have 14 facial bones. Cranial bones में one, this is frontal bone. About this frontal bone and explain. Frontal bone to parietal. इस साइड एक होगा and दूसरी साइड और एक होगा. Parietal bones. We have occipital. Occipital is one only. And this is temporal. This temporal bone. Other side also we have another temporal bone. 2 temporal bones. And we have one sphenoid bone. This is very very important. Sphenoid bone. ये नाक के अंदर साइड रहता है. Okay. ये lateral view से it will be visible here, but frontal view से नहीं दिखेगा ये. This is sphenoid bone. And just below the cavity of our nasal cavity के अंदर we have one more bone, which is ethmoid bone. Sphenoid bone and ethmoid bones are very very important, and these are directly related to हिस्टोलॉजिकल डिसफंक्शंस इन द नेसल कैविटी. किसी किसी को नेसल डिविएशन हो जाता है, किसी किसी को नेसल राइनाइटिस हो जाता है, साइनोसाइटिस हो जाता है. ऑल दीज आर मेनली एसोसिएटेड विद द स्पिनॉइड बोन्स एंड एथमोइड बोन्स. ऑफ कोर्स फ्रंटल बोन आल्सो. उसकी सिग्निफिकेंस डिसीज के बारे में, डिसऑर्डर के बारे में जब सीखोगे आपको बहुत इंटरेस्टिंग लगेगा. ओके, सो क्रेनियम के अंदर जस्ट रिमेंबर वी हैव 8 बोन्स. फ्रंटल मीन्स this one, frontal bone. Okay, one frontal bone, and here we have two parietal. इस साइड एक parietal bone होगा, इस साइड एक parietal bone होगा. These are parietal bones. And पीछे साइड here parietal bone के नीचे we have occipital bone. And sides पे यहाँ पे this one and this one, कान के पीछे these are temporal bones. And inside here you can see here inside यहाँ पे this region we have sphenoid bone and this is ethmoid bone. Okay, so these are inside actually, बाहर से नहीं, अंदर साइड. These are cranial bones. And now facial bones, you see face के अंदर mandible, maxilla, we have vomer, we have inferior nasal cochlea, this cavity, we have palatine, we have nasal bone, we have lacrimal bone. यहाँ पे आई के अंदर lacrimal bones होते हैं. So total we have 14 facial bones. ये सब bones याद रखने की जरूरत नहीं है. Just remember in cranium we have 8 bones and in face we have 14 bones. Now अभी और क्लैरिटी के लिए we will see in axial skeleton. Just now as I told, axial skeleton is composed of skull, vertebral column, ribs and sternum. In cranium we have all these bones of cranium: frontal bone, parietal bone, temporal bone, occipital bone, sphenoid and ethmoid. Okay, यहाँ पे you can see this is frontal bone, and the blue color one is parietal, two parietal bones, and this is temporal bone, and this green color one is occipital bone. And here inside the nasal cavity we have ethmoid bone, and this pink color one is sphenoid bone. एक चीज याद रख लेना. See, we have sutures, very important term, competitive exam में आता है suture, SUTURE. अब थोड़े लोग बोलेंगे सर suture तो फार्मास्यूटिक्स में आता है. फार्मास्यूटिक्स में sutures और the thread substances which are important in surgeries, to perform surgeries and to stitch the tissues. Okay, usually they are pharmaceutical aids बोलते हैं, pharmaceutical aids or surgical aids. In that suture is different and this suture is different. Okay, these sutures are joints. These are joints. Okay, skull के अंदर जो भी bones है, in skull we have cranial bones. Cranial bones are joined together with a very specialized joint which is called suture. क्या है suture? क्या है? What is suture? Suture is the specialized joint which will connect the cranial bones. Sutures are specialized joints which will connect the cranial bones. याद रख लेना. Different sutures we have. I'll try to explain you the names of sutures also. It is important. I think we understood about hyoid bone also. अब देखो. Now first bone is frontal bone. This is frontal bone. Okay. We have only single frontal bone. एक चीज याद रख लेना. Frontal bone is composed here. Frontal bone is a part of this orbital cavity. यहाँ पे ये orbital cavity बोलते हैं. Orbital cavity. Frontal bone, यहाँ पे we have one supraorbital margin. यहाँ पे एक लाइन दिख रही है आपको. Can you see the line? This line which is above the orbital cavity which is called supraorbital margin. So the frontal bone के characteristics क्या है? Frontal bone is forming a orbital cavity which is important for accumulation of eyeballs. Okay, we have eyes. It is called eye socket. Eye cavity बोलते हैं इसको. Eye cavity. Frontal bone is forming eye cavity, and just above the eye cavity we have one margin which is called supraorbital margin. Okay, and inside we have two small cavities, air-filled cavities, which are called frontal sinus. एक चीज याद रख लेना. यहाँ पे we have ये frontal bone के अंदर we have two empty cavities. I'll try to show you here. See, here we have two empty cavities. Empty cavity क्या है? Empty cavity पता है ना? We have two empty cavities in the frontal bone. Frontal bone के अंदर two empty cavities we have. These empty cavities are called अंदर होता है ये. These empty cavities are filled with air. They are filled with air. Air से भरा रहता है. And these empty cavities are called frontal sinus. They are present on the frontal bone. That's why they are called frontal sinus. अब देखो ध्यान से सुनना, ये बहुत इंपॉर्टेंट है. साइनोसाइटिस करके एक डिसीज आता है, वो सब इफ यू अंडरस्टैंड ऑल दिस कॉन्सेप्ट्स इट इज इजी फॉर यू. नाउ यू अंडरस्टूड द फ्रंटल साइनस. फ्रंटल साइनस कहाँ होते हैं? फ्रंटल साइनस फ्रंटल बोन के अंदर two empty cavities we have. These empty cavities are called frontal sinus. Understood this, everybody?
Yes, sir.
Now you see, ध्यान से सुनना. We have two frontal cavities. Simply they are called frontal sinus. Now, what is sinus? What is sinus? Sinus is the empty cavity which is present in the bones of skull. स्कल के बोन्स के अंदर एम्प्टी कैविटी अगर है तो उसको बोलते हैं साइनस. लेट मी रिपीट द पॉइंट. साइनस इज द एम्प्टी कैविटी विच इज प्रेजेंट इन द skull bones. In the skull bones, empty cavities which is present in skull bones are called sinus. These sinus are filled with air. They are simply filled with air, and these empty cavities are surrounded by a very simple thin layer, single cellular layer which is made up of epithelial cells. You might have studied about epithelial cells. This empty cavity is surrounded by a thin epithelial membrane. Sometimes what happens, this epithelial membrane is inflamed. It is inflamed due to infection. Infection means accumulation of bacteria or accumulation of वायरस और फंगस. ये तीनों से अगर किसी भी एक टिश्यू के अंदर इफ इट इज contaminated or if it is accumulated, that is called infection. Due to infection, if this layer is inflamed, that condition is called sinusitis. Now, what is sinus? Who will tell what is sinus? What is sinus?
Empty cavity which is present in a skull.
Yes, empty cavity which is present in the skull bones or in the bones of the skull. स्कल के अंदर जो भी बोन्स है उसके अंदर अगर कुछ एम्प्टी कैविटीज है उसको बोलते हैं साइनोसाइटिस. सॉरी, साइनस. नाउ व्हाट इज साइनोसाइटिस? व्हाट इज साइनोसाइटिस? इंफ्लेमेशन ऑफ साइनस. सिंपल. इंफ्लेमेशन ऑफ साइनस ड्यू टू बैक्टीरियल इन्फेक्शन, वायरल इन्फेक्शन और फंगल इन्फेक्शन. ये इन्फेक्शन के बारे में नेक्स्ट ईयर में पढ़ेंगे अपन. अभी क्या याद रख लो, एक चीज याद रख लो, सिंपल. Inflammation of the epithelial layer of the sinus cavity of this of the sinus is called sinusitis. Sinusitis सुना है कभी? Have you heard about sinusitis? Actually, अपने बॉडी के अंदर, अपने स्कल के अंदर, in our skull we have 4 sinus. We have 4 types of sinuses. Sinus means empty cavity, right? एक साइनस होता है फ्रंटल बोन के अंदर which is called frontal sinus. एक होता है एथमोइड बोन के अंदर, एथमोइड बोन के अंदर if a sinus is present, that is called ethmoid sinus. ध्यान से सुनना, बहुत इंपॉर्टेंट है. If empty cavity is present in sphenoid bone, मैं बोला था ethmoid bone and sphenoid bone are important. This is the middle part just behind the cavity of our nose, which is sphenoid bone. Sphenoid bone के अंदर अगर एक empty cavity is there, that is called sphenoid sinus. Just with the name of the bone it is named. Frontal bone में है तो frontal sinus, ethmoid bone में है तो ethmoid sinus, sphenoid bone में है तो sphenoid sinus, and here we have maxillary bone के अंदर, that is called maxillary sinus. Okay, so we have 4 types of sinus. ये थोड़ा clinical point है, it is clinical point, that's why I am just stressing here. अगर ऊपर बोन के names बता के भी छोड़ सकता हूँ, I can just tell you the names of bones and I can leave, but these are very important. Just now I told what is sinus. Sinus are the empty cavities which are present in the bones of skull. Okay, we have 4 types of sinus. Sinus present in frontal bone which is called frontal sinus. Sinus present in ethmoid bone is called ethmoid sinus. Sinus present in sphenoid bone is called sphenoid sinus, and maxillary bone maxillary sinus. Just now I told, if any sinus is infected with bacteria, the lining of that particular sinus is will be inflamed and that will cause sinusitis. अगर frontal bone के अंदर इन्फेक्शन हो गया तो उसको बोलते हैं फ्रंटल साइनोसाइटिस। एथमॉइड बोन के अंदर हुआ एथमॉइड साइनोसाइटिस। इफ एनीबडी हैज स्पिनॉइड साइनोसाइटिस इट इज कॉल्ड स्पिनॉइड साइनोसाइटिस। मैक्सिलरी बोन के अंदर है तो मैक्सिलरी साइनोसाइटिस। सिंपल, वेरी वेरी सिंपल। सी सम पीपल विल हैव एथमॉइड एंड स्पिनॉइड साइनोसाइटिस। कंटिन्यूसली पेशेंट को फॉर एवरी 3 days, फॉर एवरी वीक, एवरी मंथ पेशेंट को कोल्ड होते रहता है। फ्यू पीपल विल बी सफरिंग विथ कॉमन कोल्ड। ऑलवेज देयर nasal cavity will be inflamed. That they are considered as chronic sinusitis patient. यहाँ पे अगर फ्रंटल बोन के ऊपर प्रेस किए ना तो दे विल फील सिवियर हेडेक। ड्यू टू फ्रंटल साइनोसाइटिस पेशेंट विल बी फीलिंग सिवियर हेडेक। और मैक्सिलरी, अपने मैक्सिलरी बोन के ऊपर प्रेस करके देखेंगे ना, यू जस्ट ट्राई टू प्रेस योर बोथ दी ऑन योर फेस, ऑन योर चीक, ये दोनों जगह पे आप प्रेस करके देखो। इफ यू आर फीलिंग पेन you have to understand that you are having maxillary sinusitis. Anyways, sinusitis abhi we understood right? Actually what I wanted to tell you is frontal bone के अंदर orbital cavity form होती है. That orbital cavity you should remember, and it has supraorbital margin. This margin you have to remember. It is a characteristic. अगर ये bone एक निकाल के आपको दे देंगे तो you have to remember, you have to identify that this is a frontal bone. These are special characteristics. Okay, and it has two cavities which are frontal sinuses. Okay, that we already know. And और एक चीज याद रख लेना, this frontal bone is interlinked with the parietal bone here. Actually उसको coronal suture बोलते हैं, वो अभी दिखाता हूँ। या साइनोसाइट, ये पूरे साइनोसाइटिस किसको बोलते हैं? This is called sinusitis. You see, right side one is sinusitis, left side is normal. This is normal. Left side पूरा empty cavities है, and right side it is filled with pus. पस से fill हुआ है. This is sinusitis. Okay. अब देखो, see we have, this is frontal bone, right? This is frontal bone. Frontal bone is connected with two bones. This is one and this is two. These are parietal bones. Parietal bone 1, parietal bone 2. This parietal bone 1 and parietal bone 2 both are connected with a single suture. Okay, this single suture is called coronal suture. Now the question, frontal bone is interlinked with two parietal bones here, two parietal bones, with which kind of suture? उसका आंसर है coronal suture. Coronal suture is the joint which connects the frontal bone and two parietal bones 1 and 2. That is coronal suture. Okay, here it is written coronal suture. Coronal suture will join frontal and parietal bones. Clear? Coronal suture क्या है फिर? You should not confuse. It is very easy. Each and every term I am trying to tell you, just try to understand. एक बार पढ़ लिए तो आपको समझ में आ जाएगा. ओके, ये स्कल का पूरा एंटीरियर व्यू है. जैसे कैन सी डिफरेंट बोन्स, फ्रंटल बोन, हियर वी हैव कोरोनल. ये कोरोनल सुचर के बारे में वी विल ट्राई टू टेल यू. ओके, सुप्राऑर्बिटल, हियर वी हैव स्मॉल फोरामेन व्हिच इज कॉल्ड सुप्राऑर्बिटल फोरामेन. सुप्राऑर्बिटल मार्जिन, दिस वन सुप्राऑर्बिटल मार्जिन, एंड टेम्पोरल बोन हियर. ओके, ये अभी बताता हूँ, रुक जाओ. Now the next one is parietal bone. Just now I told we have two parietal bones. This one you can see, these are two parietal bones, 1 and 2. यहाँ पे this is one parietal bone and two parietal bones. These are located on the both the sides, on the top of our skull. Skull के ऊपर के साइड रहते हैं ये दोनों. बहुत important है. Majority of our brain is located inside this parietal bones only. Parietal bones के अंदर ही रहते हैं. Okay, these are located on the top. Now, so parietal bones, these are two parietal bones, one and it is present on the other side. Okay, so these both the bones will articulate with sagittal suture. Here just you can see we have this one is sagittal suture. Parietal bone 1 and parietal bone 2 both are connected with this red color one suture, which is called sagittal or sagittal, जो भी बोलते हैं, sagittal suture. Okay, and here this one you already know, which is this one is coronal suture on the frontal side, and पीछे this one is occipital bone. Occipital bone is again connected with both parietal bone 1 and parietal bone 2 with one very specialized suture which is called lambdoid. Here we have parietal bone. This is lambdoid suture. Lambdoid suture. इसको lambdoid suture बोलते हैं. Okay. And next one is temporal bone. Just now I told temporal bone is this one. कहाँ है temporal bone? Temporal bone यहाँ पे, हाँ, this one you see. Temporal bone. We have two temporal bones. One is in the left side and one is on the right side. पीछे right side के तरफ. Okay. So there is one significance of this temporal bone. इसमें important mastoid part of temporal bone contains mastoid process. ये सब अपने को जरूरत नहीं है. Petrous portion. Temporal bone articulates with the mandible at the tempomandibular joint. यहाँ पे mandibular joint here we have. Okay. तो temporal bone it is mainly associated with the ears. Okay. अपने कान के अंदर, कान जो है near the ears, it will connect the ears. And inside the temporal bones we have very small bones. Okay. वो just now I told the smallest bones, auditory ossicles, they are just present inside the temporal bones. Okay. उसके बाद occipital, the corner bone, this is occipital. You can see occipital bone पीछे के side. Okay, posterior side. This one is you can see the lateral view also, occipital bone. And the sphenoid bone. Sphenoid bone कहाँ है? Sphenoid bone is present inside the cavity of nasal region. Okay. And yeah, you can see sphenoid, this part, नाक के अंदर का भाग जो है, this one, it is sphenoid bone. Okay. Sphenoid bone also same, from which it is connected, which bones it is connected. एक चीज याद रख लेना, sphenoid bone structure is this. अगर कोई बोले if this kind of butterfly shaped bone if you find in the laboratory, you just try to understand this is sphenoid bone. Okay. याद रख लेना. Sphenoid bone के अंदर we have sphenoid sinus, that one you have to remember. And the next one is ethmoid bone. Ethmoid bone, this one is ethmoid bone. You can see ethmoid bone. Ethmoid bone and sphenoid bone both are special characteristic bones which is located inside the facial bones and just below the cranial bones inside the cavity of nasal region. एक चीज याद रख लेना, इसके बारे में अभी सब पढ़ के it will bore, आपको बोर लगेगा. Okay. And next one is we have facial bones. फेस के अंदर कितने bones we have? We have total 14 facial bones. Okay. Cranial bones पूरे हो गए. Now we have facial bones. We have two zygomatic or cheek bones. You can see two zygomatic bones. We have maxilla, two nasal bones, two lacrimal bones, nasal bones and lacrimal bones. Lacrimal gland के पास जो भी है उसको lacrimal bone बोलते हैं. And nasal, जो nasal area में है उसको nasal bone बोलते हैं. Inside here this. And here it is. And we have one vomer, two palatine bones, two inferior conchae, and we have mandible. So total we have 14 facial bones. याद रखना, ये एक एक bone का एक एक significance है. That all is not necessary for us to study. And next is vertebral column. थोड़ा fast जाएंगे. We have vertebral column. Always remember with a simple mnemonic: C7, T12, and we have 5 lumbar. Okay, C7, T12, and 5 lumbar. So total in vertebral column we have 24 separate movable vertebrae, C7, 12 thoracic and 5 lumbar, and irregular bones sacrum and coccyx. Coccyx बोलते हैं, coccyx, whatever you can pronounce. So C7, T12, L5 or 5L, and we have sacrum and coccyx. Okay. So total these are different bones which is located in vertebral column. Total C7, T12, L5, sacrum and coccyx. Total vertebral column के अंदर कितने हैं? 7 plus 12 plus 5 plus 2. Total how many bones we have? Okay, we have 19, 24, 25, 26. Total 26 bones in vertebral column. Okay, and यहाँ पे C7 cervical vertebrae, you can see we have 7 C7 cervical, इसको cervical vertebrae बोलते हैं. And here we have thoracic vertebrae नीचे. In here in C7 cervical vertebrae, two vertebrae are very important. The first one, C1 is called atlas and C2 is called axis. ये दो चीजें यू हैव टू रिमेंबर. इसके सिग्निफिकेंस भी है. इट इज इंपॉर्टेंट इन मूवमेंट ऑफ अवर स्कल, दे आर इंपॉर्टेंट इन मूवमेंट ऑफ अवर नेक एंड ऑल. And every cervical bones, they are having a foramen which is called a hollow structure through which the spinal cord is traveling from brain to the different parts. Okay, वो सब चीजें already you might have studied in your previous classes. So the first one का नाम क्या है? Atlas. The red one is atlas axis and remaining we have total 7 सर्वाइकल वर्टिब्रे. एक एक का नाम याद रखने की जरूरत नहीं है. इट इज नॉट नेसेसरी फॉर अस. So total thoracic 12 bones we have, lumbar 5 lumbar bones, sacrum, coccyx. About these all you can read later. I'll send this PPT to you. You can read. So yes, this is important. ये बहुत important है. Functions of vertebral column. So collectively the vertebral foramina forms the vertebral canal which provides a strong bony protection for the delicate spinal cord. ये चीज already we know. Vertebral column is important for protection of spinal cord, and because of their foramen through which the vertebral column is traveling. One thing is it is important in protection of spinal cord, and it is traveling the spinal cord from the brain to the total trunk. Okay, and we have pedicels. Actually, एक vertebrae के we have pedicels, which are intervertebral foramina, one on each side, providing access to the spinal cord for spinal nerves. Spinal nerves यहाँ से निकलने के लिए it is important for movement of spinal nerves, and they are also important in blood vessels and lymph vessels. This is another important function. एक function है, it will protect spinal cord and it will travel spinal cord. It will help the spinal cord to move from one place to another. Second one, it is having pedicels through which it helps for the movement of blood vessels, lymph vessels, and we have spinal nerves जाने के लिए. This is second function. And we have numerous individual bones enable a certain amount of movement के लिए भी it is important, and it supports the skull. It obviously we know because atlas is very important. It is supporting the skull, the first C1. And the intervertebral disc act as a shock absorbers. This is important when you run, jump, and when you do some physical activities. These intervertebral discs will protect from the friction. कभी भी friction होते रहता ना, तो they will protect from friction. And this intervertebral disc disorders बहुत सारे हैं. Sometimes what will happen, the disc will prolapse. Disc क्या होता है? See, यहाँ पे एक एक vertebrae के बीच में we have disc. Okay, not particularly for the cervical, in thoracic and in lumbar region also these discs are there. Sometimes these discs, what they'll do, they'll prolapse outside, they'll come outside like this, and due to the prolapse of this disc, patient will have severe pain, especially in the lumbar region. Lumbar vertebrae के पास this disc prolapse is seen. Because of that, patient will have severe back pain. Okay, उसके बारे में we'll discuss in disorders. That thing you have to remember. Okay, so कहाँ थे अपन? We were discussing about functions of vertebral column and vertebrae. So they are helpful. I mean they contain disc for which they will help as shock absorbers. Okay, and they'll also protect brain, spinal cord, and all from the friction. And it forms the axis of the trunk, giving attachment to the ribs. Yeah, this is important. We have each what we can say, ribs are there. Okay, ribs are coming and attaching to this appendages. These pedicels bolte, in that appendages they will be coming and attaching. I'll explain you that in rib case. Okay, so even that is also this vertebral column is very important. Okay, in attaching ribs and rib bones, rib cage bones, and also clavicle. Okay, ठीक है. उसके बाद we have thoracic cage. In thoracic cage, this is very very important. Thoracic cage contains the sternum. Here we have sternum, and we have 12 pairs of ribs. 12 pairs of ribs, and we have 12 thoracic vertebrae backside. So this total contains thoracic cage. इसका image कहाँ है? Thoracic cage. Yeah, you can see this. The total structure is thoracic cage. Thoracic cage is containing sternum, the front side bone, the front longest bone is sternum. Very very important. This sternum is interlinked with the clavicle, the collarbone, and it is interlinking with the 10 ribs. 10 ribs. Okay, and backside these ribs are going and attaching to the vertebral column. Okay, you can see. So we have thoracic vertebrae, 12 pairs of ribs and one sternum. Sternum किसको बोलते हैं? This is sternum. एक चीज याद रख लेना, sternum has three main regions. Number one is manubrium. The head of the sternum is called manubrium. This is called manubrium, and it has a body. And it has a tail-like structure which is called sphenoid process. So the sternum, this is sternum. याद रख लो. This one is sternum. Sternum is present in the front side. You can touch just between the breast tissue and breast tissue के बीच में जो होता है, that is called sternum. If sternum bone is fractured, it is very very complicated condition. याद रख लेना, sternum is very important bone which will connect the 12 pairs of ribs. Okay, ये बहुत important है, sternum is बहुत important. You can see here clavicle, इसको in the manubrium we have clavicular notch. Okay, in the body we have total what we can say cavities which are coming and joining the 10 pairs of ribs, and in the lower side we have xiphoid process. It is the tip of the sternal bone and it gives attachment to the diaphragm muscles. Diaphragm muscles के पास आके attach होता है. Okay, so sternum के बारे में और डिटेल में we will discuss later. So these are ribs. Ribs के क्या है और will okay. आज यहीं पे रोक देते हैं. You know what is floating ribs? Floating ribs यहाँ पे याद रख लो. See these total ribs. First, the 10 pairs of ribs are attached to the body of the sternum, and remaining 2 ribs which are coming from the T12 and T11, they are called free floating ribs. These free ribs are not attached to the sternum. They are not attached to the sternum. That's why they are called floating ribs. Okay, last 2 pairs जो है, they are called floating ribs. उसका significance उतना ज़्यादा नहीं है. Anyways, with this we'll conclude our topic. I think we have completed the basic thing, axial skeleton. In next class we'll discuss about appendicular skeleton, their morphology and different bones. Physiology अभी कुछ भी नहीं समझाया हूँ. I didn't explain you physiology. All these are just bones, names of the bones, where they are located, what are their characteristic feature. Okay, ये सब basic चीज़ां हैं. ये basic things if you understand, that is enough. About disorders, bones and joints, we have joints also that we'll discuss after finishing the appendicular joints, appendicular bones, sorry, appendicular system. Appendicular skeleton खत्म होने के बाद joints will discuss. That is important. Bones are not important, joints are important, very important. Classification of joints, their disorders, ball and socket joint, hinge joints. वो exam point of